Mr. Rodriguez earlier this morning discussed general treatment for athletic injuries, the kind of standard protocol, that kind of thing. I was asked to focus on one specific portion of that training, specifically the proprioceptive and coordination training that you do. This is the type of training that goes on after you're done with all the quad sets and straight leg raises and what have you. Cool, I didn't break it. The objectives define what kind of training it is, identify the need to move beyond simple strength training in athletes' rehab, discuss the benefits for training for injury prevention, recovery, and avoidance of re-injury. I'm also going to discuss a little bit of vestibular training because I do so much vestibular training during the day. I figured I'd throw it in there because I think it also would benefit athletes. Also to provide the tools to help design a sport-specific proprioceptive rehabilitation program. This is generally important for most athletes, whether they're doing whatever kind of sports. You want an athlete to have a lot of coordination and a lot of balance, whether they're doing basketball, football, or jumping over fire, which is the next slide. Yes, that's me, and it was fun.
Is that the Spartan race?
I'm sorry?
Is that a Spartan race? Right?
Actually, it's called the Warrior Dash, a lot like the Spartan race. Bunch of idiots go run in the mud and see if they can get injured, basically. Proprioceptive and coordination. Just a quick definition, proprioception is the utilization of the sensory apparatus in our muscle spindles, the tendons, the joints to determine joint position. And this is important for both static and dynamic movements. It also determines motion velocity as well as motion resistance. And by motion resistance, I mean like when you're up and moving, is it a hard surface that you're running on? Is it a soft surface? What have you. What your body does is then take that proprioceptive information and use it to facilitate coordination. Coordination being motor control of multiple joints in complex but organized patterns. Training would focus on body awareness as well as the movement coordination. Training focuses on improving the consistency of utilization of appropriate movement patterns and postures while reducing the inappropriate ones. Most athletes before an injury, after an injury, in general, tend to have very, very inappropriate movement patterns, especially that genu valgus, the hip goes internal rotation. They got that big L and tear whatever they can find in the knee or in the ankle. And you want to focus on reducing that pattern as much as possible. Also, what's really required is consistent practice over a prolonged time span to provide that reflexive reaction to the dynamic movement. Basically, you want that to be a quick reaction that the athlete doesn't have to think on. They're supposed to be watching the ball or the big dude who's about to knock them down. They don't want to be worried about how much dorsiflexion they have in the ankle while they're moving. Plus, you'd have to explain dorsiflexion to an athlete. Now, specifically, the research shows effects on injury prevention. If you incorporate proprioception and coordination training into their general training, you'll have pretty good effects on prevention of injury. Multiple studies show that high school and college athletes demonstrate the effectiveness in effectiveness in reducing injury incidents significantly during the pivoting and the contact sports. In fact, Mandelbaum showed an impressive 74 to 88% decrease in ACL injuries compared to the control group in female athletes, which is huge because female athletes blow out their ACL extremely quickly. Furthermore, joint position sense improvement is most effective in reducing injury rates compared to movement velocity and motion resistance. Basically, the better their body awareness, the less the injury rate. Emery also notes that while proprioceptive training is effective in reducing injury rates, sport-specific training program is much better than a general one, which is important to remember when you're retraining those athletes who either training those athletes who have not been injured yet or training those athletes who have been injured. You want to focus on their specific sport as therapists or athletic trainers. This is Sheila, my sister-in-law, doing think it's the Kentucky Ironman, if I remember correctly. She has participated in about 42 marathons, 11 Ironman triathlons, and she's currently training for a 100-mile ultra marathon. I bring her up partially because if I brag on her, she gets embarrassed, and that's just fun for me. The other thing is to keep in mind that a lot of the athletes that we'll be treating, some of them are the traditional basketball, football, soccer, what have you, but some of them are also the non-traditional athletes, the endurance runners, skiers, and you should focus your training aspect on whatever sport they like. In other words, a football, one that's geared towards football will not necessarily work on one that's going to be riding a bike for 112 miles. Effects on recovery. Training, especially sport-specific proprioceptive training, is very effective in redeveloping reaction time as well as action skills necessary for athletic competition. The more they practice the movement that they've lost because of injury, the quicker their reaction time, especially their reflexive reaction time. Not only does this reduce their recovery time from the injury, but also there's a lot of athletes, once they blow out their knee, they're very, very hesitant to do stuff with that knee again. Consistent practice kind of builds up their confidence in using whatever joint that happens to be injured. Markovic also noted significant improvement in jumping and sprinting performance, as well as less muscular soreness overall when they finally did return to sports. He also noted while he's doing it that non-rigid surfaces are as important to practice on as rigid surfaces, largely because most of our athletes, unless they play basketball and some sport I'm forgetting, most of them do it on a field or some other unsupported surface where the ground's going to give way from you if you hit a patch of mud. Or avoidance of re-injury. There's been some studies on it, and some studies have shown inconclusive results. Some studies have shown some impressive results. This is one of them. For ankle injuries, they noted that with appropriate sport-specific proprioceptive retraining, they've noticed that the rate of re-injury actually returned to the original rate as subjects without an injury history. So you take somebody with an unstable ankle and you actually make it more or less as stable as it used to be. Well, not the ankle itself, but the movement. I like this picture. This is also the Kentucky Ironman. If you'll notice, this is the bikes for 1,300 athletes. Little side note, 1,300 bikes, 1,300 athletes, 9 porta potties in the back. Okay. Now, as far as training specifics, there are many, many things I like to focus on with the proprioceptive and coordination training. First off, rehab cannot be isolated to just strengthening of one joint. You should also focus on the hip stabilizer musculature, which is very neglected a lot of times, especially for I see it a lot in my student therapists as they come out of school. They get a knee joint and they focus on the knee. I'll go into more detail of these in a minute. Also, neutral joint mechanics should also be focused on during most dynamic movements. Static versus dynamic training, as well as vestibular training, because I've had many, many people trip and you have to catch them. Also, with their eyes closed, now, granted, this is from physical therapy school, but I imagine it's also true for the athletic trainers and everybody else. Whenever we were taking tests, you'd always see somebody stand up halfway through the test. They'd close their eyes and they'd move that particular joint to kind of figure out the question on the test. Generally, when you close your eyes, you have a better idea of how your joint is moving. So whenever you have them do the exercise with their eyes closed, they are focusing more on joint position sense while they're moving. It takes away distraction, basically. Also, as I said before, it eliminates visual bias that you have of the 300-pound lineman in your face. And then, like I said, vestibular usage is increased. This is specifically due to you take away the visual aspect of it, and they have to use their proprioception and their vestibular system to maintain balance. Well, if you also have them doing a proprioceptive activity, their attention on proprioception is focused on specifically joint position. So they're not using the information from the proprioception to maintain their balance so much. So with eyes closed, the vestibular system has to kick in, and thus it'll become more improved. Also drills. Athletes like drills. Should be very sports. This is the sports-specific portion of it. The drills that you have them do should be specific for the sport. Watch them while they do them, and make sure they're maintaining the appropriate movement patterns that you want them to do. The joint neutral, no excessive movement, that kind of thing. And then also, if you have an athlete like my sister-in-law and you don't know what drills they do to train for their sport, I guarantee they know them. Just ask them what do you do in their practice, your practice, and have them do it over and over and over and over and over until they get good at it. Once again, also harping on them constantly of that neutral positions, that the appropriate movements, and also staying away from the inappropriate movements. Common exercises, the static single leg stance is a very common one, focusing on basically that plumb line we all know. The core is straight up and down. The hip that they're standing on is neutral, but also the pelvis is not dropping or raising. Once again, dynamic movement is much better than static, so you can always have them stand on one leg and do stuff that you can play catch with them. My favorite is actually if they're really bad at pronating through the ankle, but it's not a kind of a deformity in the foot, it's more of a muscular issue. You can always have them stand on one leg and do rotatory activities, an external rotation for the hip. And if you stand up and do it, you'll feel your ankle pronate, and kind of defeats that whole supination that a lot of people get with the flat foot deformity. Not the deformity, but the flat foot tendency. Single leg loading and squats is a good way also to get them back. You have a lot of people do a squat. Not only do they do the squat wrong, but they also tend to have valgus in both knees when they do it. So you want to really harp on that whole use your extensors and not your use your hip extensors and not your quads to do the squat, and that kind of thing. It's a good way to start the ball rolling on them paying attention to their body awareness. The karaoke exercise, which is spelled a couple hundred ways. I like to spell like the singing thing just because it makes me laugh. Forwards and backwards running. Obviously, you want them to focus on jogging and running while maintaining the appropriate postures while going forward. But a lot of athletes don't go straight forward. They go backwards, they go sideways, they go diagonal, and you want them to go in that direction. I love backwards because backwards kicks in those hip stabilizers. They kick in the ankle stabilizers. It hits the quads like crazy. It's a great exercise to do, and if you have them run and they can run very stable, you got them almost back to sport. Run backwards very stable, you almost got them back to sport. Rope and obstacle drills. There's a reason that coaches have them do that. The better you can run over a different obstacle, the better body awareness you have and the better coordination you have for foot placement while you're running. Jumping, forwards, backwards, sideways. You can have them jump on boxes, what have you. As long as, again, they're not doing the faulty movement patterns, it's a great way to get that explosive component that we're all looking for, especially linemen. Also suicides, just because I had to do a lot of them, so that vengeful streak in me, I like to make my patients do a lot of suicides too. All activities, also a good thing to focus on, all activities should begin on very stable surfaces such as carpet or concrete, and then progress to the unstable surfaces. I visited the Wounded Warriors program in San Antonio, where they're returning amputees and different kinds of injured soldiers back to the fields in Iraq and Afghanistan. And one of the things they love to do is they start on normal surfaces, and then they have pits, long pits of gravel, they have pits of mud, they have pits of sand, and they have them do the same activity they got good at, and they have them do it on unstable surfaces. Now, I'm not saying you should go to your clinic and dig a hole, but it's something you can focus on, look around and see how you can mess up the surface. My favorite trick is I have about 15 sponges, instability pads that I work for my balance patients, and I line them all up and have the athlete run down and back doing different drills on those sponges, and it's not a very easy exercise to do. Eyes closed or quick head turns can also increase the difficulty. Especially, it makes them look goofy, but you do want an athlete that can keep his head on a swivel. And it's something to keep in mind that the athlete should be able to do the exercise while doing more dynamic head turns. Also, catching an object manipulation will also increase the difficulty. Throw something at them while they're running, especially if you don't warn them. It's actually pretty fun to do.